soluble. Okay, you cannot give through IV because it cannot be dissolved in liquid. Okay, that's why we give water insoluble drugs to IM. Because IM in the intramuscular, they have a lot of layers of these lipid layers, and actually helps to dissolve the drugs for better distribution and absorption. Okay, all right, that's my two questions that I got from last week's lecture. Okay, we continue. I think Dr. Ubaidullah and Dr. Arifah, actually they have already have their lectures, their earlier lectures on introduction of okay guys, if you have any questions, you can actually feel free to interrupt me okay, during the lecture. You can actually interrupt me okay, and ask anything if you want to understand like that. Okay, so Dr. Ubaid already have give lectures on anesthesia, right? General, local, and also inhalant anesthesia. So okay, I will continue okay. With the drug actually. Okay, my lecture is all about the drug actually affecting several systems in the body Okay, so we start off with the nervous system Okay. Okay. This one is actually just end of lecture. Let's be able to okay, student be able to identify drug that acts on the nervous system, anticonvulsant, sedative, opioids, neural analgesics. Okay, this one you can actually pass this one. Okay, before we start with the drug that actually affects the nervous system, you must guess, this one is physiology, right? Which physiology did you learn? Nervous system, physiology 3, right? It is still fresh last semester you had your physiology 3. So you should know what is the basic unit of the nervous system. You know it's a neuron. Okay, the neuron is actually divided into sensory, associative neuron, and also motor neuron. And the parts of neurons, we have the cell body, the dendrite, so the axon. Okay, and the nervous system actually divided into two. We have the CNS, which is the central nervous system, which consists of brain and spinal cord. It was clear, right? And also we have the PNS peripheral, which includes the cranial nerves, spinal nerves, and optic nervous system. Okay, this one later we will have lecture on this. Okay, so today we'll actually concentrate on the drug that affects the central nervous system. Okay, this is the sympathetic nervous system. You guys know, right? Okay, we have this cranial nerve and something like that. Okay, so this one is just something. It's not foreign to you guys. You just saw this last semester, right? Okay, so there's no issue Okay, we can actually skip this. Okay, so the drug is actually how do we address it? Is actually based on the classified. Is based on the action the drug has on the body Okay, actually affecting the nervous system Okay, the first category of CNS drug is actually it acts to be as a tranquilizer, sedative, and also anti-anxiety drugs. Okay, so they are actually same, but they are tranquilizer, sedative, and anti-anxiety. The purpose is actually, the objective is quite the same, but how does it differ is actually the amount of depth of the activity of animals. Okay, after they are given these drugs, they actually differ between these three things Okay, tranquilizer is actually used to calm. They used to calm animals. Okay, reduce anxiety and also aggression. Okay, right, and then the groups that actually used as tranquilizers, we have is promazine, okay, and also chlorpromazine. They are all phenoldiazine derivative. Okay, sedative is actually used to quiet excited animals, okay, decrease irritability and excitement. Okay, sedative normally we use for animals, let's say, okay, tranquilizers we use normally for wild animals because one thing about wild animals, they tend to have these terms called capture myopathy. Okay, capture myopathy is that when they become agitated or startled, for example, if you want to try to catch them, they can actually develop this condition called capture myopathy, and then they will if the cardiomyopathy happens on the muscles, myo is actually muscle, it happens on the muscles of the heart, okay, for example, actually cause cardiac arrest, okay, and the animal can die. Okay, that's why tranquilizer is not that death of the calming the animal is not as severe as using sedative or anti-anxiety, because if you want to actually do you want to catch wild animals, okay, and also if you want to maybe calm them before doing any procedures on them, okay, if you before you actually want to perform surgery, for example, okay, before that it's like a pre-medication thing, okay, use tranquilizers lah, okay, calm the animals, okay, and then because it reduce anxiety and aggressions. Alright, for the sedative, it's usually used to quiet excited animals. Okay, they want to decrease irritability and excitement. And also anti-anxiety drugs. Okay, they actually use to lessen anxiousness and but not make drowsy lah. Okay, anti-anxiety drugs. Okay, all these drugs. Okay, example in this group they can be used. You can use actually phenothiazine derivative. You can use also benzodiazepine and also alpha 2 agonist. Okay, I'm not going to actually tell more about the drugs in the group. Okay, just I want to pinpoint what is the drugs actually commonly used for these three groups lah. Okay, for example, phenothiazine derivative is probably is the most common drug used as a tranquilizer, sedative, or anti-anxiety drugs. Okay, and also for the benzodiazepine is diazepam, and for so alpha 2 agonist, okay, it's actually xylazine. Okay, this is the drug that you when next semester or maybe when you during your fourth year when you enter surgery classes and also when you do work at the hospital. Okay, later on in your clinical years, okay, you're going to actually encounter most of these drugs lah. Okay. Okay, so for espromazine, okay, this one is actually not in the notes I have. You have to actually write this down lah. Okay. Okay, espromazine is actually to reduce anxiety and also produce mentally relaxed state. Okay, all right. Okay, espromazine is actually often used to calm animals during physical examination. Okay, often used to calm animals during physical examination and also during transport. Okay, so espromazine doesn't produce any analgesic effect. Okay, you have to know some of these drugs used as a tranquilizer, sedative, and also anti-anxiety drugs, they only actually reduce the response. Okay, but they don't really produce any analgesic effect, so the animals still can feel pain. Okay, that's why, for example, if you want to do physical examination, you suspect a dog, for example, coming to the hospital and have fracture, maybe pelvic fracture. So it's quite painful. Okay, let's say you want to do an X-ray on the dog, okay, to see fracture site and the severity of the fracture. Okay, before transporting the animals to the you have to actually give tranquilizers first, and then you have to just give the animal some form of analgesic drugs, so that is actually you can actually perform the X-ray or actually manipulate the area where you want to check for the fracture site. Okay, so be careful, and that's why before anything, to be safe, it is fine if it's on its cats, okay, maybe a small dog. But for example, if it's very large dog, and they have pain, and you actually didn't know that the animal doesn't have any form of, even any tranquilizer, sedative, or anti-anxiety drug before you want to give, when you want to transport them, you must make sure that they actually come and also given local anesthesia or general anesthesia before you perform anything. Okay, espromazine actually can also be used to decrease vomiting. Okay. All right, they are actually used as motion sickness. Okay, I say you can if you see some of the tablets are used as a motion sickness drugs for human, they actually comes from phenothiazine derivative. Okay, piperazine, espromazine, they are all all this zin at the back, they are all group from phenothiazine derivative. Okay, they are used as a motion sickness drug. Okay, if you want to go to a island, for example, okay, and you actually, the boat is actually hanging there, here and there, you have to take some motion sickness drug before you travel. Okay. Alright, ispromazine actually use, they function by blocking the alpha-1 receptors. Okay, block the alpha-1 receptors found on the smooth muscle cells. Block the alpha-1 receptors found on the smooth muscle cells of peripheral blood vessels. Okay, in all these peripheral blood vessels on the smooth muscle cell, they have these receptors. Okay, you know that some of these compound neurotransmitters, for example, okay, they requires a receptor to bind to the drug before it takes effects lah. So in order for the drugs to work as a tranquilizer, sedative, and also anti-anxiety, they have to actually block. Ispromazine have to block the receptor from the neurotransmitter to be attached, so that the effect is not going to occur. Okay, that's the function, okay, of this. Alright. Ispromazine actually will cause muscle relaxation, okay, and also cause vasoconstriction. Okay, vasoconstriction is actually the blood vessels becomes smaller lah. Okay, and also they will cause muscle relaxation, also vasoconstriction. Okay. Alright, the side effects of using ispromazine is that side effect doesn't mean it's adverse. Side effect is not. You have to actually differentiate between adverse effects and side effects. Adverse is kesan sampingan berbahaya. Okay, right. Side effect is kesan sampingan only. Okay, you have to understand. Those who are international students, okay, adverse and side effect is two different things. Sometimes student will actually be confused lah. Side effects doesn't mean that it's actually a bad effect. Okay, side effect is something that actually not physiologically harmful to the animals compared to adverse effects. Okay, so ingat, remember, side effect is kesan sampingan, adverse effect is kesan sampingan yang berbahaya. Okay, so side effects of ispromazine, actually they will cause protrusions of the nictitating membrane. You know what's the nictitating membrane? Anybody knows? Where is the nictitating membrane located at in cats? In the eye, right, of the cat. Okay, you can see the nictitating membrane lah. Some people, okay, the layman term call it as the third eyelid lah. Okay, for cat it's called as third eyelid. Alright. They will also cause a transient permanent penile prolapse in stallion. Okay, you know what's penile prolapse? Okay, susah lah kalau yang lecture face-to-face, I can actually draw lah. How does a stand, okay? So because you just actually imagine lah. You try to imagine yourself. Okay, try to visualize how as a transient or permanent penile prolapse in stallion. Okay, the side effects. Okay, the third side effect is actually it has an antihistaminic effect. Okay, so sometimes ispromazine or the phenothiazine derivative group can be used also as a allergies medication lah, because they have an antihistaminic effect lah. Right. Okay, that's for ispromazine. Okay, the next group is actually diazepam. Okay. Okay, diazepam is actually alright, it can reduce anxiety, okay, and regression. Right. Diazepam can reduce anxiety and regression. Okay. And normally they are used to relieve anxiety disorder. Okay. in human, for example, student or people who are actually individual, they are actually having anxiety disorder, they are given diazepam as the medication to actually manage the condition. Okay, you can see anxiety. Okay, in some people they have an anxiety disorder because they tend to become anxious all the time. So normally the psychiatrists they will actually prescribe diazepam to this patient because they have and they have the ability to relieve anxiety disorder. Okay, so they have a really marked marked taming effect. Tame. Okay, that's why they are used as an sedative or anti-sedative drugs to allow animals to be handled more easily. Yes, diazepam. Okay. Any questions so far for diazepam? All right, diazepam can also be used as to induce sleep. Okay, okay, can be used to induce sleep. So same with if a sleep disorder. Okay, people actually take diazepam, but you must remember diazepam is actually a controlled drug. Okay, you will need prescription in order for you to actually obtain this drug. Okay, it's not something that can be sold over the counter lah. Okay, you have to have prescription for that. That's why people who actually have having having anxiety disorder, insomnia, okay, difficulties to sleep, they actually get prescription for this type of drugs. Okay, diazepam also reduce muscle tone and coordination. Okay, all right, and diazepam also has a suppression of the cardiovascular system. All right, but it's not very prominent lah. It's very weak type of effect on the cardiovascular system. Okay, it's lower a bit lah, the heart rate, okay, and the pulse rate, heartbeat of the animals. Okay, right. Some practice, okay, they use diazepam as a pre-anesthetic protocol. Okay, okay. For your syllabus in Malaysia, okay, in the faculty, we were actually using mostly phenothiazine, espromazine as a pre-anesthetic protocol lah. But certain certain school vets European, maybe North American, Australian, they actually using they teach students to use diazepam as a preemptive protocol Okay, but we don't want to actually it still depends for it doesn't have any sort of advantage between each other, but mostly because that maybe they thought that diazepam they has a much more prominent effects of actually reducing the anxiety and as a sedative effects much greater than espromazine, but actually doesn't have that kind of very distinct difference between each other okay. So because they use this as a preemptive protocol because of their calming, also they have a muscle relaxing effects that's why they use diazepam. Okay, however, diazepam it's not useful okay, in preventing motion sickness, okay, compared to espromazine okay, they not. So don't have to, sometimes people actually tend to actually go and meet doctors, say that I need diazepam because I have motion sickness. Okay, because actually they won't just want the drug because they want to get high. Okay, diazepam doesn't have that useful in preventing motion sickness because the drug itself doesn't react with the receptors actually on the receptors that actually control right the equilibrium, okay, or the motion sickness center, okay, the motion center in the brain. That's why they're not actually useful for preventing motion sickness. Okay, they also have properties of increasing appetite, okay, as a PAM. Okay, that's why people who actually have anxiety okay, and they actually have on medications on diazepam, they actually tend to eat more because they have increased appetite. Okay, all right. Because this diazepam they have effects on the appetite center. Okay, siapa yang very thin kurus they don't have any okay, selera makan okay, you actually get diazepam lah. You will actually become smart. Okay, eat more lah. Alright. Okay. Any questions? Diazepam?
Doctor, I have a question.
Yeah, correct. Yeah, Tan Zian. Yes.
Yes, doctor, I'm just wondering, when do
Mhm.
you know that the medication is sedation or tranquilizer, since diazepam can be used in both sedation and tranquilizer?
Mm-hmm.
So
Which
I'm
one?
just wondering when is it at a situation where when is it sedation and when
Okay.
is it tranquilizer?
Alright. You look at the situation. If you want, just now, as I said just now, if you see that animals, if you want to do a very simple physical examination, if the animal is not cooperative, okay, you can use tranquilizers lah, okay, espromazine for example, or diazepam, very low dose because it's just a PE, you want to check an animal, you don't want to the animals to react negatively towards you touching them, okay, looking at doing some very procedures like okay, looking at their eyes using torchlight, something like that. Okay, that's the use of tranquilizers. You use sedative. Okay, if example, you catch an animal in the wild, for example, and then the animal is actually not very first time, okay, seeing any people, person, okay, a human being, they get really agitated, really excited. So use those okay, that are used for sedative, okay, either espromazine, benzodiazepine, also alpha 2 agonists. And also, if you want to probably animals, as I said just now, animal they have maybe fracture, okay, on bone fracture or something like that, you want to maybe lift the animal or transport the animals, and you say if you touch the area where they have fracture, and then they will actually go and become aggressive. So you want to calm them a bit, okay, give sedative, okay, to them, sedative dose, so that they become calm, and then later on you give them maybe local anesthesia in the area where you suspect the fracture, or maybe give general anesthesia so that you can manipulate the area with the fracture, and also probably take x-rays, because all these procedure they are actually going to be very very restless for the animal, and they become excited. That's why. Okay, look at the situation now. Okay, all right. Any other question?
Dr.
Yeah.
Can I ask, why is acetaminophen used for vasoconstriction?
Pardon?
Why
Why
does
is promotion used for vasoconstriction?
yeah,
Mm-hmm.
it's like vasodilation.
It cause vasoconstriction. How does it does that?
I think it's vasodilation.
Mm-hmm. Vasodilation or vasoconstriction?
But you said it's for vasoconstriction.
Oh, I told you vasoconstriction. I'm sorry. It's actually vasodilation.
Oh, is it? Okay.
Sorry. I was thinking of some other drug. Sorry, okay, it's actually a vasodilation. Forgive me about that. Okay, thank you, Saji, for reminding me that. Okay, it's called vasodilation. When you have vasodilation, you will have in decrease in blood pressure. Okay, all right. And that's why the animal will become more stronger because the blood pressure is actually going down. It causes vasodilation. Okay, right. That's logic from that rational lah. Okay. Oh, sorry. Okay, next is actually the alpha 2 agonist. Okay, xylazine. Okay, alpha 2 agonist, the name itself is the name that because they stimulate the alpha 2 receptors. Alright, that on the neurons that normally release norepinephrine. Okay, they stimulate the alpha 2 receptors located on neurons that normally release norepinephrine. whereas the norepinephrine is actually a neurotransmitters lah. Okay, there's two different things. Agonist is actually to promote, to stimulate, right? Antagonist is the opposite lah. Okay, you see, if you want to reverse the actions of an alpha-2 agonist or other agonists, you use the alpha-2 antagonist or maybe beta-1 antagonist. Okay, or if the drug is actually used to agonize or antagonist or agonist the beta-1 receptor, you use an beta-2, a beta-1 antagonist to reverse the action. Okay, all right. Okay, this compound also, alpha-2 agonist, they have a calming effect, okay, and they decrease in animal ability to respond to stimuli lah. Okay, decrease the animal ability to respond to stimuli. Okay, so they actually attach to these receptors, alpha-2 agonist receptors actually, and prevent the neurons to release the norepinephrine, the norepinephrine lah. Okay, they attach, okay, to the receptors on the neurons, the alpha-2 receptors on the neuron. Thus, actually, they prevent the release of norepinephrine. Okay. So, the one that is common used for large animal is rompun. You heard of rompun before? The trade name is rompun. Okay, they are used for large animals. And for animals, small animals, they are used as Ilium xylazine. Okay, we have that drugs at the back in the pharmacy. Later on, when you have practical on the pharmacy, if you can actually, we have a face-to-face practical later on, maybe you can actually go to the pharmacy and have a look at all these drugs. Okay, all right. If alpha-2 agonist is given as a sedative dose, remember, if alpha-2 agonist is given as a sedative dose, maybe the high dose is much higher, they can actually cause vomiting. Okay, right, because it actually affects the chemoreceptor trigger zone on the stomach, okay, on the brain, okay. So you trigger that and you will cause a sedative effect, will actually cause vomiting lah. Okay, that's why, again, as Tanzian just now asked, if you want to use this again, if you see the animals, if they have a gastric torsion, for example, gastric torsion, a blockade on maybe the stomach or the gastric torsion, and you give these drugs as a sedative dose, okay, what will happen? Okay, they try to vomit, but they think because the stomach is actually blocked or maybe got torsion, torsion, like the blade, like triangle. So later on, we actually will exert pressure on the tissues and also the muscular area that in that organ. They will have stomach rupture, intestinal rupture, something like that, esophagus rupture. Okay, that's why before you want to, if you suspect the animals have any type of this gastrointestinal blockade, something like that, you have to actually don't give the dose as a sedative dose because it really can cause vomiting. Or we have other complications. Okay. All right, guys. If I already exceed like 10 a.m., please let me know. Because I cannot in online class we cannot actually time ourselves lah. Sometimes we talk too much and actually we realize we already like half an hour past the time already. Okay. All right. Okay, in horses, xylazine can be used. It can be used to relieve pain. They have some type of analgesic properties. It can be used to relieve pain associated with GI and other abdominal conditions, such as colic. Okay, right? They are used to relieve pain associated with GI and other abdominal conditions, such as colic. All right. They can also be given as to control visceral pain, visceral pain associated with intestinal disease. Okay, control visceral pain associated with intestinal disease, but their analgesic effect is not as effective lah. Okay, as other drugs that we use as analgesia. Okay, alright. In cattle, okay, alpha-2 agonists like xylazine, they can be used to reduce rumen motility. Okay, in condition where you have when you want to reduce the rumen motility, you can use xylazine. Okay, they can also be used to promote an early onset of parturition, okay, for pregnant animals lah, in cattle lah. Let's say the animal is actually the calf or the fetus inside the animal, somehow they actually died inside in utero, okay, and you want to actually the animal having an early parturition, or you want to abort the fetus, you can actually give xylazine together with the other hormone. I can't remember what hormone actually can actually promote parturition. What hormone can we use? Physiology, what hormone can we use to actually promote? I think it's estrogen. You can give estrogen actually to promote the maybe prolactin hormone, something like that. You can actually use to promote early parturition or or calving, for example. So because in xylazine, they can be given because they increase the uterine smooth muscle contraction. Okay, they increase the contraction of the smooth muscle of the uterus, so that we have an early onset of parturition. Okay. All right. As for tranquilizer, sedative, and anti-anxiety, okay, there's 3 drugs. Any questions? Okay, we move. Other question? All right. Thank you. We move to anticonvulsants. Okay, anticonvulsants is actually another sort of action drugs that acts on the nervous system. Okay. Ya, 2 minit minum air. Yang Indians dah masak ladu belum? For Raya tomorrow. Raya tomorrow or today? Tomorrow. Maruku dah masak. Ladu dah masak.
Baru lah.
Ada masak baru berkari ya? I suka baru berkari. Alright. Anticonvulsants actually they help prevent seizures by suppressing the spread of abnormal electric impulses from seizure focus to other areas of the cerebral cortex. Okay, they are actually anticonvulsants. Okay, they are all anticonvulsants are CNS depressants. Okay, and may cause ataxia, drowsiness, and hepatotoxicity. What's the meaning of ataxia? Loss of cognition, they're called ataxia. Drowsiness is actually drowsy, you know what drowsy, right? And hepatotoxicity is actually toxic to the liver lah, hepatotoxicity. Okay, they can actually cause liver damage lah. Okay, all these anticonvulsants. That's why when people use anticonvulsants for epilepsy, for in humans, the dose must be controlled, and also they have to actually have a regular checkup lah, okay, blood checkup, okay, to see whether the drug is actually start to affect your liver lah. If it's just the case, okay, the doctor will actually have to maybe change type of anticonvulsants, or maybe they have to reduce the dose depending on the conditions of the animal, or maybe the human itself. Okay. Examples of anticonvulsants, okay, the groups, or example, they are phenobarbital, also known as the short-acting barbiturates, Primidone is another drugs. Okay, structurally similar to phenobarbital, structurally similar, but the effect is different and the delay same, but the depth or maybe the action is much more greater than phenobarbital. Diazepam is another type of anticonvulsants. Okay, they are given IV to treat status epilepticus. All right. Normally, status epilepticus is actually in human and chlorazepam is another adjunct anticonvulsants and potassium bromide. Meaning by adjunct, they cannot be used as alone. Okay, they must be used together with other anticonvulsants lah. Okay, in this case, normally chlorazepam can be used as anticonvulsants together with phenobarbital or other type of or diazepam or also primidone. Same also case for potassium bromide. But potassium bromide is actually not technically a drug. Okay, potassium bromide is more toward like a chemical compound lah. Okay, people seldom use lah, but they have some sort of anticonvulsant effect lah. But if you have choices of these five, try to actually remove or try to actually avoid the use of chlorazepam or potassium because they are one, they need to have another anticonvulsant as to work together, and they are actually not that greater effects if they are actually used alone. Okay, so I'm going to talk more about the most commonly used drug used as a anticonvulsant, which is phenobarbital. Okay, phenobarbital is actually drug of choice lah. Okay, drug of choice for long-term control of seizures in dogs and cats. Okay, all right. They have a very long half-life. Okay, you know what we mean by half-life? Half-life. Okay, half-life is actually a term used for drugs. Okay, the amount of drugs left in the body. Okay, for example, you have 100 milligram of drug injected to the animals lah. Okay, let's say after 1 hour, when you check the level of drugs in the animals, they only have 50 milligram of drugs left. So meaning that 50 milligram already been excreted out from the body. So it tells you that the half-life of the drug is actually 1 hour. Okay, that's the term. Okay. The amount of time achieved for the concentration of the drugs to remain in the body, that's the half-life of the drugs. You know what's important? Why is half-life important? It's because you want to, normally it's the dose, you want to know the dose response of the animals. Okay, of the drugs. That's what people study about the half-life, because let's say if you want to create a drug that be used, for example, in antibiotics, we want to know what is the next dosage of the drugs need to be given in order for the animal to have a prolonged effects of the antibiotics for the animals. So they actually study the half-life so that they can actually extrapolate what is the amount of time for the drug to be cleared from the body so that they can actually promote a second dose or design a second dose for the drugs. Okay. Alright, that's why we study the half-life. So half-life of phenobarbital is actually 37 to 733 hours, which is quite long. Okay, so example, if you use the drug, example on Monday, so maybe on Wednesday, Monday morning, maybe on the Wednesday afternoon, only the drug, okay, they will actually have 50% is actually left in the body. Another thing is that that's good to have a long half-life because you do have to have a repeated dose of the drug. As I said just now, the drug is actually hepatotoxic. So if you have to give the drug every day, later on they will actually cause the damage in the liver much faster. Okay, that's why it's good to have a long half-life, so you do have to have a repeated half dose. And as I said, they have until 733 hours of half-life. 733 hours is what? 24, 48, 48, 73, maybe like 3 days. Okay, 3 days for the drug to only less than 50% in the body. So you have to. That's why it's very good to be used as a long-term control for use of good dogs and cats. Okay. They are actually metabolized and biotransformed in the liver. Okay, that's why they put a very large toll to the liver because they are biotransformed in the liver. Phenobarbital, it enters the body, the form itself not going to be effective. All right. So in order to be effective, they have to be biotransformed. In that they have to be changed structurally into a secondary metabolites. Okay, the secondary metabolites will actually be effective to control seizures. Yeah, okay. So they have to be biotransformed in the liver. Okay, some of the drugs, they have actually a direct effect. So meaning that they enter the body, they will actually go straight away to the target site, actually have the direct effect, meaning that the first metabolites itself, the drug itself in its original form, they can actually act itself on the target tissue or cell or organs. But a certain drug like phenobarbital, they have to be biotransformed first because their original form or the first metabolites, they cannot function. That's why they have to be transformed in the liver, okay, so that it can be used, the secondary metabolites can be used to treat the seizures. Okay. That's why they are very, very toxic to the liver. Okay. Because it takes toll to the liver functions. Okay. They are actually highly protein bound. Okay, meaning that the drug actually binds to protein. Okay, so that it can be transported to the site to the target sites. Okay. All right. So because they are actually protein bound, if you animals is having a low plasma protein in the blood, okay, low plasma protein in the blood. Okay, for example, if animals with liver disease, they have a low plasma protein. So more phenobarbital will be available in the free form. Okay. So more free form, they will actually diffuse. All this free form will actually diffuse to the brain. Okay, so they can actually produce the clinical effects. So meaning that animal with hypoproteinemia, meaning that they have a very low plasma protein, okay, you only give a very, very small dose. You don't have to give large dose. Okay, because they are highly protein bound. Okay, yes, somebody wants to ask question? Okay, never mind. Okay, right, we move. Okay, 10 minutes more. Okay, I will try to. Cat has less ability than dogs to metabolize phenobarbital. Okay, so because they have a less ability to metabolize phenobarbital, so the dosage, okay, in cats is normally lower than those in dogs. Okay. All right. Okay, that's for phenobarbital. Okay. All right. For pyrimidone, diazepam, oxazepam, potassium bromide ni, I think they have studied. It's not very commonly used Okay. All right. Pyrimidone, they have the same function as phenobarbital. Okay. But they have a very short half-life. Okay, the half-life is only 2 hours. Okay. Pyrimidone, they only have 2 hours half-life. Okay, this one comes to the term later on. Let's say after you graduate, you open your own clinics. And then your clinics actually very popular for treatment of animal epilepsy. Okay, at one point, when you become famous one day, your clinic, very good people come over and you become greedy. For example, like ethics. This is one ethical. You say, okay, I want to change the use of phenobarbital as treatment by and use pyrimidone. Okay. The one is actually unethical because Primidon, they have very short half-life, only 2 hours. Okay, and then you can charge the client more by giving more drugs. Okay, so instead when you have a phenobarbital, it's actually 3 days. Actually, like one single dose can last maybe 1 week, for example. So you charging your unnecessary cost owners lah. It was actually ethical. Later on, you can still you can actually still use Primidon. For example, if phenobarbital, for example, the animal is actually allergic or resistance, you can use. But if the animal still can phenobarbital, then continue lah instead of usually. This because this one comes back to ethics, ethics way of practicing lah. Okay. Okay, this is how benzodiazepine lah, phenobarbital works lah. Okay, diazepam works lah. Okay, how does it works? By actually replacing the receptors on the tissues on the cell Okay. Should we continue or I think yes. And this one is quite banyak juga lah. Maybe we can continue on Monday Nimalan, Monday is still technically holiday or class day? Class Okay. Alright. So you raya cukup ke 2 hari je? People celebrating Deepavali cukup ke raya 2 hari je? Monday nak kelas lagi? Okay lah, alright. Okay, we continue on Monday Okay, Monday nanti we continue on this energetics lah. Okay. Then Monday at 9 kan? Sama kan? 9 kan?
Yes.
Okay, so I see you guys on Monday lah. Okay, 9 AM Same lah, same platform lah. Okay, before I go, we actually we start the lecture first. We continue next Monday. I would like to actually wish everyone celebrating Deepavali, happy Deepavali. Okay, and those not celebrating Deepavali, you also celebrate Deepavali. Okay, happy holidays lah to all of you. Stay safe Okay, during this pandemic lah. Okay, we'll see you guys on Monday Okay, Assalamualaikum. Good morning.
Thank you.
Thank you.